My name is Daniel Lee. I'm a pediatric and adult ear and skull-based specialist, otherwise known as neurotologist and neurotologist. I am Director of Pediatric Otology and Neurotology here at Mass Eye and Ear, as well as Program Director of the Harvard Neurotology Surgical Fellowship. I am also Director of International Patient Services in the Department of Otolaryngology at Mass Eye and Ear. I have a specialized expertise in the care of both children and adults with routine and complex ear conditions, especially those conditions that involve hearing loss or tumors of the ear or the skull base. These conditions really can be cared for ideally at Mass Eye and Ear because of our multidisciplinary approach and because of our talented roster of surgeons, clinicians, nurses, and staff. I graduated from Columbia College in New York and I moved on to Baltimore, where I received my medical degree at the Johns Hopkins School of Medicine. I then stayed on for another 7 years of surgical training in the Department of Surgery and then the Department of Otolaryngology at Johns Hopkins Hospital. My research focus has been in the area of auditory implants and specifically trying to develop new technologies to enhance the quality of life for patients who are deaf and cannot receive the cochlear implant. Secondly, we have developed really exciting minimally invasive surgical approaches through endoscopic ear surgery for the treatment of pediatric and adult conditions of the middle ear. And then finally, we have developed a national and an international center of excellence for the care of patients with superior canal dehiscence syndrome. My research laboratory focuses on developing a new generation auditory brainstem implant. These are specialized devices for patients who are deaf but cannot receive a cochlear implant because of the growth of brain tumors. And so my lab has been focused for the past almost decade and a half on developing new strategies and new technologies to be able to improve hearing outcomes and overall improve the quality of life of these patients with a condition called NF2. I was born and raised in Minnesota, and from there I've been in the Northeast. I live here in Boston with my incredible wife, who is also a surgeon scientist, and her 3 wonderful children. And when I'm not busy taking care of those 3 kids, I spend my time in the evenings as an astrophotographer, a hobby that I picked up during the pandemic.